So I'm Bella Bushby, the Communications and Policy Officer at Positive Life New South Wales. I just want to say I'm really privileged to be a part of the 2019 Innovations in Cancer Treatment and Care Conference, so I can share the community voice regarding HPV-related cancer awareness among women and trans and gender diverse people. To start, I'd like to acknowledge the lands on which we're meeting today, the Gadigal people of the Eora Nation. It always was and always will be Aboriginal land. The other thing I'd like to acknowledge is my role as an ally to people living with HIV, rather than someone living with HIV myself. The work I present here today respects the primacy of the lived experience of people living with HIV, or PLHIV, and their centrality and guidance in investigating this information. I'd like to thank all the people and community members who participated in the survey and gave their advice and time freely. So a bit of background, human papillomavirus, HPV, is a common sexually transmitted virus that around 80% of people will contract, usually through sexual activity at some point in their lives. Most people with a healthy immune system tend to clear the virus on their own. However, people who are immunocompromised, such as people living with HIV, have a higher risk of HPV-related cancers, as immunocompromised systems find it harder to clear the infection. Evidence to date shows that people with a cervix and living with HIV are 3 to 6 times more likely to develop HPV cervical cancer than the general female population. They are also at greater risk of developing anal, vaginal, throat, mouth, and vulva cancers. Studies have shown that the incident rate of anal cancer in women living with HIV could be anywhere between 7 to 28 times higher than the general female population. For the first time in Australia, national cervical cancer screening guidelines have been created to specifically address immunocompromised people, which includes people living with HIV. The recommendation is to have more frequent cervical screenings of every 3 years rather than 5 for the general population. Due to the recognised rise of people living with HIV diagnosed with HPV-related cancers, particularly anal cancer, Positive Life initiated a focus into research of our community's awareness of HPV screening and related cancers. The reason this research came into focus for Positive Life was a result of a previous survey we had on anal cancer awareness in 2016. The survey was aimed at all people living with HIV, however, we only had a very low response rate from trans men and cisgendered women. This low response rate suggested that engaging women and trans and gender diverse people around the issues of anal and other HPV-related cancers could be an important next step in accessing awareness of HPV-related cancers and improving health equity for all people living with HIV. As a peer-led and peer-run agency, Positive Life realised the need for a targeted women's and trans and gender diverse people survey, and to make sure we offer ways for all people living with HIV and affected by HIV to voice their experiences, barriers and challenges about this important topic. In 2018, Positive Life partnered with Femme Fatales, the Australian network of women living with HIV, and developed an anonymous online and hard copy survey. We targeted women and trans and gender diverse people living with HIV, HIV negative but immunocompromised women and trans and gender diverse people, and other HIV negative, non-immunocompromised women and trans and gender diverse people across Australia. Our survey aimed to evaluate awareness and knowledge of HPV infection and risk for cervical, vaginal, vulva and anal HPV-related cancers among women and trans and gender diverse people in Australia. To assess whether respondents were aware of HPV vaccination and the new national cervical screening guidelines, specifically the new recommendations for people living with HIV and solid organ transplant recipients. To identify any potential healthcare access barriers. To assist with the prevention of morbidity and mortality by increasing screening, early detection and treatment of HPV-related cancers, and to inform the development of educational resources to increase community and healthcare awareness of HPV-related cancers. Women and trans and gender diverse people were central to the development and implementation of the survey, which was peer-reviewed by key informats. The survey contained 48 quantitative and qualitative questions and was distributed online and in paper format from the 9th of March to the 11th of May 2018. Types of questions we asked community were based on around topics of demographics, level of awareness of HPV-related cancers, patient-doctor communication and treatment, screening and diagnosis, staging and treatment, vaccination, and information resources and support. Promotion and dissemination of the survey engaged HIV sector partners and sexual health clinics across Australia. We utilised social media networks and we leveraged promotion at events and on national awareness days. So the results. 355 women and trans and gender diverse people responded to the survey. 14.4 were HIV positive, 5.6 were HIV negative but immunocompromised, and 76.6% were HIV negative. There was also 3.4% who preferred not to disclose or are unsure of their HIV or immune status. For the purpose of presenting these results up here, I just have combined the groups and we'll be discussing all responses and highlighting where people living with HIV has stood out in comparison. Out of all the respondents, the survey found extremely low awareness of the recommended screening guidelines, particularly among respondents living with HIV, when none of the respondents were aware of the specific 3-yearly guideline recommendations for them. Out of all respondents, 43% had a conversation about HPV-related cancers, and the remaining 57% had not had a discussion about HPV-related cancer with their healthcare professional. Of the 43% who had a conversation about HPV-related cancer with their healthcare professional, 98.6 had discussed cervical cancer, which was really great. 8.5 had discussed vaginal cancer, 7.1 had discussed vulvar cancer, and only 2.8% had discussed anal cancer. There was low HPV vaccination rates, which were also recorded from the survey. Overall, 66% hadn't been vaccinated, and 7.3 were unsure if they'd been vaccinated or not. Respondents reported feeling uncomfortable to discuss HPV-related cancer with clinicians, with 20.7% who felt neither comfortable nor uncomfortable, 9.4% felt uncomfortable, and 11.9% felt very uncomfortable. And lastly, qualitative responses indicated that respondents would prefer increased public awareness of HPV, and clinician-initiated, non-judgmental conversations with female doctors or nurses who were non-dismissive, clear, and made them feel comfortable. The main outcomes we've seen from this... I think I'm missing a slide. Implications. While Australia is on its way to effectively eliminate cervical cancer, from these results, we can identify a range of barriers and gaps in knowledge that could contribute to low rates of vaccination, lack of awareness of cervical screening guidelines, subsequently increasing the likelihood of increased delays in screening and diagnosis of HPV-related cancers. We can also see a demonstrated reliance on the health professional to bring up the conversation of HPV. When this is coupled with high discomfort talking about HPV-related cancers, we can see the implications of reduced discussions about vaginal, vulvar, and anal cancers, and therefore less screening. Survey respondents summed this up with, "If I didn't know better, I think the 5-yearly cervical screens were applicable to me. However, because of my immune system, I need 3-yearly. This information isn't readily available without some prior knowledge to know what to search for." Outcomes. Main outcomes we've seen from this research is we need to do more to educate and inform people with the cervix, including those who are immunocompromised and living with HIV, about HPV-related cancers. Women and trans and gender diverse people, including people who are immunocompromised and living with HIV, require targeted resources, engagement, and communication about guidelines, vaccination and symptoms, and HPV-related cancer risk. While we've made progress in screening for anal cancer for gay and bisexual men, we currently have no anal cancer screening guidelines for women and trans and gender diverse people living with HIV. To date, we've published a report with key actions and recommendations, and I've put a few up the back if anyone wants to grab one on the way out. We've also convened a task force with high-level professionals to provide advice, guidance, and input into implementing these recommendations. Findings from the survey have been discussed at multiple conferences, including the Patient Experience Symposium and ASHM Sexual Health and HIV/AIDS Conference. And we're in the process of designing community and health professional fact sheets and collateral discussing HPV-related cancers. I'd just like to leave you with a quote from a survey respondent. "I try to keep up with all that's happening. However, this survey has put the importance of HPV back on my radar for my upcoming appointment. Thank you for your time.
Any questions for Bella? No one's surprised that I have a question. So the ARHW a couple of weeks ago produced their latest cervical screening report that showed that women who weren't vaccinated were about 10% less likely to participate in the cervical screening program. And so you've had women who are not vaccinated. I wonder if you asked about their cervical screening status and behaviour?
Just trying to remember within the report. I think we asked the amount of screens they'd had and how recently in the time apart, but I can't remember what data we pulled from that off my head right now.
No, thank you. That's useful. Any other questions or comments for Bella before she runs away? No. Okay, fantastic.
Cool.
Thanks very much.
Thank you.